Hello students. Today's class in oral histology will be about pattern of shedding. What is shedding? Shedding of deciduous teeth is the result of progressive resorption of the roots and the periodontal ligament of deciduous teeth. Now something to note is only the natural exfoliation or fall off of deciduous teeth is called as shedding. It is accomplished by multinucleated giant cells and osteoclasts. Growing and eruption of permanent tooth dictates the pattern of deciduous tooth resorption. Histology of shedding. Resorption of hard tissue is brought about by odontoclasts, and resorption of soft tissue is brought about by the pulp and periodontal ligament. To be more precise, by the cells of the pulp and periodontal ligament. Odontoclasts. These are cells responsible for removing dental hard tissue during shedding. Similar to osteoclasts, they are derived from monocytes. They migrate to the resorption site and fuse to form multinucleated giant cells. They are characterized by the presence of ruffled border and sealing zone. Important one word. Odontoclasts are characterized by the presence of ruffled border and sealing zone. They have the ability to resorb predentin. In this image, resorption site, these hollows and these round pupils-like areas in eosin are the odontoclast. Histology of shedding, pulpal response. While the root is being resorbed, coronal pulp appears normal, with odontoblast lining the predentin. Once the root resorption is almost complete, the odontoblast degenerates. Mononuclear cells migrate from the pulpal blood vessels and fuse to form odontoclast. Just before shedding, odontoclast migrate away from the dentin surface and the remaining pulpal tissue secrete cementum-like substances. The tooth is shed with some pulpal tissue intact. This is a point to note. When the deciduous teeth is shed, some amount of pulpal tissue is intact. Histology of shedding and the periodontal ligament response. Shedding leads to abrupt loss of periodontal ligament. Pattern of shedding. The pattern of shedding is symmetric in both right and left sides. That is, it happens synchronously on the right and left sides. Lower E sheds first before upper E. That is, the lower second molar in the deciduous dentition sheds first before the upper second molar. Girls' teeth shed before that of boys. So girls precede or go ahead of boys in terms of shedding, though they are of equal age. Sequence of shedding in the mandible follows anterior to posterior order, while in the maxilla, the first molar sheds before the canine. This is an important one word. Sequence of shedding in the mandible follows anterior to posterior order, while in the maxilla, the molar sheds before the canine. Pattern of shedding in relation to the anterior teeth. For all the deciduous anterior teeth, resorption is initiated at the lingual side of the root. The growing permanent tooth becomes directly below the deciduous tooth. Resorption happens apically. Pattern of shedding in relation to anterior tooth is illustrated. The 3 points which were given is given by the diagram. For all deciduous anterior teeth, resorption is initiated at the lingual side of the root. If you can see, figure A, resorption is initiated at the lingual side of the root. Second point, the growing permanent tooth becomes directly below the deciduous tooth. In terms of anterior teeth, the permanent tooth bud comes directly below the resorbing or the yet to shed deciduous tooth. Third point, resorption always happens apically. Apically, resorption starts. This is the pattern of shedding in deciduous anterior tooth. Moving on to deciduous posterior tooth. For deciduous molars, resorption is initiated on the inner surface where the permanent premolars develop. You can see Second point, later the premolars come to lie beneath the deciduous molars. Third point, the shift in position may account for intermittent nature of resorption. Image of pattern of shedding in posterior teeth. You can see how the deciduous molars are being succeeded by premolars and permanent molars. Abnormalities of shedding are of 4 types: retained deciduous teeth, submerged deciduous teeth, remnants of deciduous teeth, and pre-deciduous teeth. Retained deciduous teeth. Most common retained deciduous is the upper B and lower E. That is the upper lateral incisor and the lower last molar. Most common cause of retained deciduous is 3 causes: congenital missing permanent teeth, impaction of the permanent teeth, or ankylosis of the deciduous teeth due to trauma. Submerged deciduous teeth. Most common submerged teeth is the lower second molar, lower E. Most common cause of a submerged teeth is ankylosis. Submerged teeth have no active eruption and are at a low level than the other teeth. Remnants of deciduous teeth. Roots of deciduous teeth, especially molars, are retained and they interfere with eruption of permanent teeth. This happens due to more diverged roots of the deciduous teeth and the smaller premolar size. Pre-deciduous teeth. This is also an abnormality of shedding. They are also known as rootless teeth or natal teeth. Rare condition in newborn infants, may cause eruption cyst in newborns and cause discomfort during lactation. Most common pre-deciduous teeth is the mandibular central incisor. Ending this class, moving on to MCQs. Most common retained deciduous teeth is dash. Options: option A, lower E, option B, upper A, option C, lower D, and option D, lower C. Most common retained deciduous teeth is option A, lower E, that is the mandibular second deciduous molar. Second question, dash is also known as rootless teeth. Option A, pre-deciduous teeth, option B, submerged teeth, option C, retained deciduous teeth, and option D, any of the above. Answer is option A, pre-deciduous teeth is also known as rootless teeth or natal teeth. That's all for this class, students. Thank you.